Today we're going to review a Popliteus release. Popliteus is the muscle right behind your knee. Oftentimes when it gets tight, usually from sitting and keeping the knee bent like I am right now, it's going to restrict some of that blood flow, that circulation. Now, also, if ever you've experienced knee pain or movement dysfunction or tension through the knee, kind of think of it similar to shin splints, where those calves get really tight and pull on the shin. Same thing can happen with the knee. You might feel the pain up front or the tension up front, but in the front we have bone, our kneecap, and just some skin. Right behind, in the popliteal fossa, you'll notice a lot more space. Muscles, nerves, arteries, veins, fat. So this is where all the circulation and swelling goes. So if you've been feeling any sort of knee dysfunction, pain, tension, this is a great spot to focus on. Now, it's just a very small muscle, and it's important that you get your body nice and relaxed for this. So first I'll show you how to utilize your thumbs to release this muscle. I like to put both those thumbs right next to each other. They're gonna be placed behind my knee. I'm gonna push my thumb tips out towards my kneecap. Okay, so I have to angle that upwards. You get into a little bit of a precarious situation here with your positioning. Find that spot, push upwards. You're gonna have to push fairly hard to get into that muscle. And then I like to go side to side, moving the thumb side to side slightly until I find that muscle nodule or the knot. And then apply that more pressure just to lock that spot in there. If that's easy, I'll continue that cross fiber friction going side to side. I'm going to stay on that spot until the pain goes down by half. Now, most research will suggest that's about 3 to 5 minutes. Now, if that becomes too easy for you eventually after a couple of weeks, you can lock that in, lift up, and try to straighten your leg out. A little bit of active release, pin and stretch through this region too. Now, you can ultimately add in some rotation at the end. You're going to feel a little bit more play with that. But for most people, just keeping nice and simple, applying that pressure in there deep to yourself, keeping it static will be just fine. Now, another way you can utilize is going to be using your lacrosse ball. Throw that behind your knee, close the knee down, hug the knee in towards your chest, keeping that ball locked in place, and then do some big ankle circles. Do about 10 in one direction. After those 10, you're going to go into the other direction. Again, with the same goal here. Do it until the pain goes down by half, which is typically 3 to 5 minutes. So make sure you allot enough time for that, and look forward to the results you're going to feel through your knee afterwards. Have fun.